If your baby is waking again and again and you're staring at the clock, wondering how this became your whole personality, you are not alone. Night wakings are one of the biggest stress points for parents because they're confusing, unpredictable, and they hit you when you're already exhausted. I'm Dr. Mona, pediatrician and mom, and today we're going to break down the real reasons your infant wakes at night, how to figure out why your baby is waking, and what you can do to support longer stretches with or without sleep training. And if you like calm, clear guidance that cuts through the noise, hit subscribe. Think of it as white noise for your parenting brain. Let's jump in. Before you start doing detective work, you need a reality check on what's normal. A lot of frustration comes from expecting something your baby's body simply cannot do yet. Newborns have immature sleep cycles, tiny stomachs, and no sense of day or night. Their nervous system is still learning how to settle. They wake because they need calories. They wake because they can't link cycles yet. Their sleep is light, loud, and full of wiggles. So if they fall asleep on you and wake the second you put them down, that's not a mistake. That's newborn biology. Between 4 and 6 months, everything changes again. Sleep cycles mature, babies become more aware, growth spurts hit, and the 4-month regression, or progression, is a real thing. Sleep may look worse before it gets better because their brain is reorganizing. Between 6 and 12 months, separation awareness increases, motor skills explode, discomfort from teething shows up, and congestion from sick season makes nights tricky. And yes, even at this age, one night wake can still be typical. So instead of thinking something is wrong, think their brain and body are busy. And now that expectations are grounded, let's talk about why your baby is waking. Most night wakings fall into a handful of categories: hunger, comfort, overtiredness, undertiredness, developmental changes, sleep associations, environment, discomfort, or habit wakes. Some babies wake because their sleep cycles are still maturing. Some wake because evenings get overstimulating. Think bright lights, loud voices, toys everywhere, basically a toddler rave before bed for your infant. Some wake because they're practicing a new skill. Maybe they're learning how to crawl. Maybe they're learning how to roll. That is happening at sleep time and can wake them up. Some wake because the room is too warm or too bright. And some wakes become habits because a cue keeps repeating. And this is where parents usually have their biggest aha. When your baby wakes, it feels urgent. But if you pause and ask the right questions, the patterns become clear. First, is this hunger or comfort? A focus feed and quick resettle usually means hunger. Wanting closeness usually means comfort. Hunger cues change with age. Under 6 weeks, rooting and hands to the mouth are helpful signals. After 6 weeks, those cues are less reliable because babies use their hands to soothe or explore. So look at the whole picture: the time since the last feed, how awake they are, and whether they're showing real interest in feeding or if a feeding is being offered. Second, does this wake happen at the same time every night? Same time usually means schedule or rhythm. Random time suggests development or comfort. Third, are they practicing something new? Rolling, sitting, crawling, pulling up, or new sounds. Anything they learn in the day becomes a nighttime activity. Fourth, did anything change in the last day or two? Maybe you traveled, visitors, staying out late, a skipped nap, a very exciting day, getting vaccines, or overstimulation. It can all show up at sleep time. Fifth, what was bedtime like? Loud, bright, energetic evenings make it hard to settle. Babies need a slow landing, not a last-minute sprint. Sixth, are they connecting sleep cycles yet? A quick fuss then quiet means that they're trying. Full crying every cycle means the skill is still developing. Seventh, are they getting enough daytime calories? Distracted feeders often reverse cycle and take more calories at night. Eighth, could this be discomfort? Gas, teething, congestion, or constipation can all cause disruptions. Ninth, is this a sleep association? Babies often want the same help overnight if you've been giving that same thing. So for example, if they pop out a pacifier and you keep putting that back in, and they keep popping it out and you keep putting it back in, that's showing that they have a sleep association that you can kick with the right strategies. 10th, is their developmental age different from their numerical age, or are they just different? Preemies and sensitive nervous systems move through sleep skills differently. And if this detective work is helping things click, tap subscribe. It helps the algorithm avoid doing its own 2 a.m. wakings. Before we match the reason to the fix, let's talk about pausing. Pausing does not mean ignoring your baby. Pausing means listening. A pause is information. Babies make tired cries, hungry cries, frustrated noises, and little between cycle fusses. Pausing helps you understand which is which so you can respond with intention instead of panic. For newborns, keep pauses short, 5 to 10 seconds. Newborns grunt and wiggle in active sleep and are not actually awake. A tiny pause protects their sleep. After 6 weeks, the cries can get confusing. Is it hunger? Are they moving through sleep cycles? This is when slightly longer pauses can help you learn your baby's patterns. A pause might be 10 seconds, 20 seconds, 1 minute, or a few minutes if they're not escalating. Some babies at this age can tolerate a pause up to 5 minutes. Not 5 minutes of wailing, but up to 5 minutes of listening, watching, and learning. And remember, if they're making small sounds, grunts, whimpers, don't do anything. I'm talking about 5 minutes of an escalating cry where it sounds like they may not go down to sleep. By 6 to 12 months, pausing continues to be helpful. You may now pause 5 minutes as you've become more familiar with pausing. But remember, if they're escalating or they sound distressed, you go to them. Pausing is not ignoring them, it's gathering information. And the reason why this is so important is that many parents can inadvertently wake their child up by intervening when their child is making normal sounds. Maybe it's a whimper, maybe it's a fuss. And when that happens, they tend to go to a feeding. What will happen here? The baby will take the feeding because they're being offered it and not because they actually need it. So by pausing, you are ensuring that you know exactly what your baby may need and getting that information so that you can learn what they may need if you don't already. Now that you know how to pause with purpose, let's match each why to the solution. If it's hunger or comfort, protect daytime feeds by keeping them calm and low distraction. Routines in daytime feeding can really help. But if you have a newborn under 12 weeks, make sure you grab my newborn sleep workshop for more guidance on how to promote a routine, but also not how to stress over that routine. And you may expect younger babies to need calories overnight. Like I mentioned, it's very normal for nighttime wakes to happen for food. When your baby is under 3 months, you are going to approach their comfort needs as you want. After 3 months, your philosophy may depend on your sleep training or sleep teaching approach. You can go in, hand on the chest, a short rock, a pick up, put down, Ferber method, but stick to what you want with predictability. Keep the room dim, your voice low, and your interactions boring. No need to turn on all the lights, have a whole production when it's sleep time. We want them to associate sleep is a quiet, relaxed time, even if you're doing a diaper change, even if you're going in for comfort or a feeding. If the wake happens at the same time every night, this is often rhythm or timing. Now, your approach for a baby over 4 months can be sleep training, and I have a bunch of resources on that. You may want to look at their schedule if you need to shift the bedtimes, adjusting naps, but a slightly longer pause at that predictable wake can often help break the pattern. And that is important if you're not ready for a full-blown sleep method, including one that may involve crying. If they're practicing something new, give them lots of floor time and daytime practice. At night, help them calm without turning it into playtime. Again, if you approach this with sleep training after the age of 4 months, do that. Or you can just pause briefly so they can wiggle and settle unless they're really upset. You'll notice that a lot of my guidance just depends on your sleep approach. And remember, I have a lot of resources to help guide you, whether you're looking for a cry method or a more low cry method for your family. If something changed in the past day or two, expect temporary disruptions and try to get back on a routine if you had it. Focus on a calmer evening the next night, dim lights, gentle play, and the same routine can help the nervous system reset. If bedtime was overstimulating, make the evenings quieter. Babies again need a slow landing, dim lights, soft voices, and predictable sleep. If your child seems well, meaning they don't have a fever, they're comfortable during the day, you can approach these night wakings, treat them like a regression. And if you have any questions about regressions, I have a YouTube video about sleep regressions that can really help. If they aren't connecting sleep cycles yet, this is where pausing shines. Short pauses for younger babies, longer pauses for older ones. Keep your response boring and consistent so nighttime doesn't become entertainment. And again, my newborn sleep workshop and all my resources have more guidance on this. If they're not getting enough daytime calories, create calmer feeding spaces to prevent reverse cycling. Help them focus and take full feeds in the day. And remember, you cannot force them to eat. You are merely just offering the feedings on a routine during the daytime so that they can get more feeds in so they're not waking up more at night. If they're in discomfort, treat what you can. Upright positioning for congestion, pain support, or fever-reducing medicine if needed, or gas relief strategies. You're going to do short pauses here because discomfort usually needs hands-on help. If this is a sleep association, keep bedtime and night support aligned. Choose one way they fall asleep and be consistent. Over time, you can dial down how much help or intervention you're giving with that sleep association. If their developmental age is different or their developmental temperament is different, you are going to take the strategies I mentioned and make them your own. Again, there's no one size fits all, so it's important to understand the why so you can come up with a strategy that works for your baby. And now a quick word on sleep training or sleep teaching, because parents always ask, where does this fit? Sleep training is simply one structured way to help older babies build sleep skills with clear, steady responses. It isn't ignoring your child, and it isn't the only path to better sleep. It can be helpful for repeated comfort wakes, strong sleep associations, babies over 3 months who aren't linking cycles, and those predictable rhythm wakes that happen at the same time every night. And here's the part parents don't hear enough. Even sleep-trained babies still wake sometimes. My son was sleep-trained at 2.5 months, and my daughter slept through by 12 weeks from strategies in my newborn sleep workshop. And they both had very typical wake-ups, common through the first year. Sleep training doesn't erase normal development, teething, illness, or separation awareness. It doesn't remove the need for comfort during growth. What it can do is give families a steady framework that makes nights easier when things are typical and expected. And many sleep-trained babies move through regressions or setbacks a bit quicker because they already have some independent sleep skills to lean on. If a family wants to explore sleep training, there are many styles, and you can choose what fits your child's age and temperament. And if it's not for your family, that's completely fine. There are plenty of ways to support healthy sleep with or without it. No matter why your baby wakes, these habits help. A calm, dim evening, a predictable bedtime routine, age-appropriate wake windows and looking at sleepy cues, consistent settling, low-stim nighttime care, steady daytime feeds, a cool dark room, and using the pause wisely. Think of these as your sleep necessities. It's important to get extra eyes if your baby wakes every hour for weeks, if they're snoring or labored breathing, if they're eating poorly during the day, if they're working hard to breathe, or if something just seems off. Asking for help isn't failure, it's care. It's really important to bring up any sleep concerns to your child's clinician to make sure there's not something medical or developmental we need to evaluate. Bottom line, hear this. Night waking is very common in the first year, even in sleep-trained babies. There's so much happening. Babies sleep longer when their body, schedule, and development line up, not because their parent is perfect. You aren't creating bad habits by responding. You're supporting your child. Focus on connection, focus on timing, and give yourself some grace. Longer stretches will come. The most important thing is having a routine and a rhythm and an approach that makes sense. If your goal is independent sleep or longer sleep stretches, that is going to become so important. And if this helped, please make sure to hit that thumbs up sign, subscribe so this show can continue to grow, and make sure you check my caption below for all of my sleep resources, because I believe every family can sleep and every child deserves sleep being supported. I'll see you all next time. Stay well.